Section 1, Introduction, the Burden of Infectious Diseases. Infectious diseases have long cast a shadow over humanity, shaping history through devastating pandemics and ongoing outbreaks. These ailments, caused by pathogenic microorganisms such as bacteria, viruses, fungi, and parasites, continue to pose significant challenges to global health. Despite advances in medical science, infectious diseases remain among the leading causes of death worldwide, demonstrating our ongoing battle with these invisible enemies. From the Black Death to the Spanish flu, history is riddled with moments where infectious diseases have dramatically influenced populations and economies. Today, diseases such as HIV, AIDS, tuberculosis, and malaria highlight the uneven impact on various regions, particularly in low- and middle-income countries. The emergence of new diseases and the re-emergence of old ones due to changing ecological and social conditions add to the complexity of public health challenges. The global community faces the dual challenge of controlling existing diseases and preparing for the next potential pandemic. This preparation involves understanding the behaviors, carriers, and treatments of different diseases. Each section that follows will delve deeper into specific infectious diseases, starting with the well-known, yet often underestimated influenza. The importance of public awareness and education can hardly be overstressed. By understanding more about these diseases, we can better participate in prevention and control efforts, thereby safeguarding individual and public health. Section 2, Influenza, the seasonal scourge. Influenza, commonly known as the flu, is a highly infectious respiratory disease caused by influenza viruses. It sweeps across the globe in annual outbreaks, causing symptoms that range from mild to severe, and at times can lead to death. The flu affects 5 to 15% of the global population each year, with millions of cases reported and up to 500,000 deaths, particularly among the young, the elderly, and those with weakened immune systems. The flu virus is notorious for its ability to mutate rapidly, which complicates vaccine development and makes annual vaccinations necessary. Each year, scientists work against the clock to predict the most prevalent strains and develop a vaccine that matches them as closely as possible. This ongoing battle against the flu underscores the challenges of dealing with viruses that can easily adapt and change. Prevention strategies include vaccination, which remains the most effective way to prevent the disease and its complications. Public health campaigns stress the importance of hygiene practices, such as regular hand washing and covering coughs and sneezes to curb the spread of the virus. As winter approaches in each hemisphere, health services gear up for the influx of flu cases, which can put significant strain on healthcare resources. As we explore the relentless impact of influenza, the discussion naturally leads us to another devastating infectious disease, tuberculosis. Known as the silent killer, tuberculosis has a long and complex history with humanity. Section 3, Tuberculosis, the silent killer. Tuberculosis, or TB, is one of the top 10 causes of death worldwide and the leading cause from a single infectious agent, ranking above HIV/AIDS. It's caused by the bacterium Mycobacterium tuberculosis and primarily affects the lungs, although other parts of the body can be involved. Each year, millions of people continue to be infected with this bacteria, with significant numbers resulting in death. Despite the availability of a vaccine and effective drug treatments, TB remains a major public health issue due to factors such as antibiotic resistance and HIV co-infection. The battle against TB is further complicated by its ability to remain dormant in a person's lungs for years, only to become active when their immune system weakens. Efforts to combat TB include improving diagnostic methods, increasing access to treatment, and enhancing public health strategies to prevent its spread. The fight against tuberculosis is not just a medical challenge, but also a social one, involving issues of poverty, stigma, and access to healthcare. As we delve deeper into the complexities of tuberculosis, we uncover the struggles and the ongoing efforts to eradicate this persistent menace.